Hello everyone and welcome back to my channel. Today I will be talking about some of the important terms and structure of the residency program, especially for foreign medical graduates. These are the terms which I did not know much about until I started my residency. I will be mostly talking about internal medicine, but some conferences may overlap with the other specialties. Here is this timestamp for today's video, and with that, let's hit the intro. Morning report. Morning report is a type of conference meeting held in the morning. Times may vary for that conference from program to program. Typical time is 7 a.m. or 8 a.m. and usually lasts from like 30 minutes to an hour. During morning report, first year resident presents the interesting case or new admissions from last night to all the residents and attending physician. During this conference, we go through differential diagnosis and appropriate tests and treatment. We also discuss what could have been done better and what was done right. Every case presents a new opportunity for residents to learn from the case. Noon conference. Noon conference is a lecture held by different specialty in the afternoon time for about 40 to 60 minutes. Noon conference is the time to learn from the expert of different specialty and what's their thought process and what do they expect from our specialty when we are taking care of the same patient. Frequency of morning reports and noon conferences may vary with the different programs. M&M, Morbidity and Mortality Conference. This is the conference where we discuss near deaths, errors, and mortality caused by system failure of some kind. The purpose of this conference is to identify system error, knowledge gap, or communication errors. In these conferences, residents present the cases without patient identifier or any blame to any other provider. During this conference, speaker presents the case in a timeline fashion. For example, patient came into the hospital at 8 a.m. with a complaint of chest pain, was seen by ED physician at 8:30, and troponin was drawn at 10 a.m. and so on, all the way till the end. And at the end of the presentation, attendees get a chance to ask additional questions about the case. After that, presenter and attendees find the errors that happened during this case and how it can be improved. We try to identify the errors with the root cause analysis and fishbone diagram. Fishbone diagram is a diagram which has a different causes and also has a sub-causes as well. I'll put the picture of the example. Journal club. During the journal club conference, presenting resident picks any published paper and we all critique the article as a group. Article for conference is chosen based on recent change in guideline management or a study challenging existing belief established in medical community. Then during the conference, paper gets presented with the key points, and at the end of the presentation, attendees critique the paper on several criteria, including but not limited to funding of the study, design, exclusion criteria, inclusion criteria, and predictors and modifier of the study, what they did right and what could have been done better, and what should be done in the future studies as well. Journal Club provides excellent opportunity for medical students and residents to learn more about research and how it's done properly. Next is a teaching service, also referred as inpatient flow rotation. Basically, it's a rotation where you will be the primary physician for admitted patient and the one who will be accepting admission from the ED physician as well. Next is 4+1, where 4 represents 4 weeks of inpatient floors rotation or ICU or night duty, where 1 can represent ambulatory rotation, consulting service, or vacation. This type of schedule provides residents a good work-life balance, where after working hard for 4 weeks, you get comparatively light rotation to recharge yourself. I do not want to generalize this, but ask wherever you interview that what is their +1 week looks like. Different institutions define +1 week differently, but that's the core principle behind 4+1 schedule. Similar goes for 6+2. I hope this video provided you useful insights. If you like my work, please don't forget to subscribe and let me know what would you like to know next in the comment box. Till then, goodbye.